how are you today?
Good, how are you?
Good. My name is Kenley and I will be your student nurse today.
Okay.
What's your name and date of birth?
Kelsey, 6/12/92.
Can I go ahead and check your wristband?
Mm-hmm.
Thank
Kelsey.
you. I'm just going to do some hand hygiene. Maintain comfort, privacy. So what brings you in today?
I'm just here for an annual checkup, so
Okay.
no complaints or anything.
Okay. Do you have any pain on a scale of 0 to 10?
No pain, 0.
Okay, sounds good. I'm going to put some gloves on. Can you go ahead and tell me what day it is today?
It is the 20th, I believe.
Yep.
Yeah.
And do you know where you are?
I'm at Mid-America.
Okay, sounds good. So today we're just going to do a assessment, and does that sound like the reason you would be here for
Yeah.
a physical
Yeah.
assessment?
Mhm.
Okay, sounds good. Patient seems to be alert with level of consciousness, and I have the curtain closed right now for comfort and safety. Can you tell me what you had for breakfast this morning?
I actually didn't have breakfast, but I had a coffee.
Okay. Do you typically have breakfast, or is that
Usually I'll have a protein bar, but
Okay.
I was rushing this one.
Okay. Patient is alert and oriented ×4. They appear to have a good nutritional status, seem like a healthy weight. For her height, she's sitting erect and has no obvious deformities that I can see. Her facial expression is pleasant, and her mood and affect are positive, and her speech is appropriate, and she articulates words well, and she seems like she knows why she's here and what she's doing. And her personal hygiene seems up to par. So I'm just going to look at your skin, and I'm just going to be assessing different parts of your body. If you have any discomfort or pain, just please let me know. So I'm just going to look at your skin a little bit. Pigmentation is even, just some small freckles. Temperature is warm to touch on both sides, and kind of a pale pinkish color. Her nails are not brittle or dry. They seem healthy, and her capillary refill is less than 2 seconds, which is good. And go ahead and just slide your fingers up like this. No clubbing, so that shows that she is healthy. And I'm just going to check her skin turgor. Okay, a good hydration status. And next we're going to look at your eyes.
Okay.
So the first thing I'm going to do is a test by confrontation. And so what that means is we're going to look at your peripheral vision. And so what I'm going to do is I'm going to use this pen light, and I'm going to come from behind you, and I just want you to tell me when you see the pen. Okay? So go ahead and cover this eye right here, and then just tell me when you see it.
Yep.
Yeah. Yeah. Okay, keep that same eye covered. I'm going to come from the other side now. Okay, go ahead and switch eyes for me. Tell me when you see it.
Yep. Yep. Yep.
Okay, keep that same eye covered.
Yep. Yep.
Yep. Okay, now I'm just going to look at the structure of your eyes. Your sclera is a nice china white. I'm just going to put it on your eyes. If I don't see that it doesn't look red or inflamed, you're not going to let that look good. Your iris is an appropriate color, and they're symmetric bilaterally. Your pupil size is about, I would say about a 4 right now. And so I'm just going to look at your reflexes now. So the light appears in the same spot on each side, and now we're going to look at your pupillary light reflex. So I'm just going to shine this twice, and both eyes constrict. Both eyes constrict. Okay, now I want you to follow my pen light and just only use your eyes, don't use your head, and I'm just going to move it into different directions.
Okay.
Okay, now we're going to do the accommodation test. So what I'm going to have you do is I'm going to have you focus on the wall. And then I'm going to bring my pen light in front of you. When I tell you focus on this, focus on this. I'm going to say wall, focus on the wall. So go ahead and look at the wall. And focus on the wall. Pen light. Wall. Okay. Pupils dilate and constrict appropriately with accommodation. So next we're going to look at your ears, and the first thing I'm going to do is a whispered voice test. So I'm going to have you cover this ear right here, and I'm going to whisper some words, and I just want you to repeat them back to me.
Blue dog.
Okay, go ahead and switch ears.
Purple cat.
Okay, all words are heard in both ears, and now is when I would look inside the tympanic membrane, but we're not going to do that today. I'm just going to look at your external ear structures, pull on them a little bit, any pressure or pain, feels uncomfortable. Okay, next we're going to look at your head, face, and nose, so I want you to go ahead and raise your eyebrows for me, puff out your cheeks, let the air out of your cheeks, and smile. Good job, you're doing great. It's kind of funny. Smile. Okay, perfect facial symmetry. I'm just going to palpate your scalp.
Okay.
And no lesions. Hair is appropriate color for ethnicity. It isn't dry or brittle or breaking easily. Okay, and head is normocephalic, which means that you have a normal head size. And now I want you to open your mouth and bite down. Any pain with that? Okay, open your mouth and bite down. Okay, TMJ and maxillary are intact. I'm just going to feel your sinuses. Tell me if you have any pain when I touch your sinuses. Okay. Now we're going to do test your sensation to see if you can feel a sharp and a soft object.
Okay.
So when I touch you with each of these things, just tell me where you feel it and what it is you're feeling, sharp or dull.
Okay. Sharp. Soft. Dull. Sharp. 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 Dull.
Great job. Now we're going to look at the patency of each of your nostrils. So I want you to go ahead and occlude one of your nostrils and take a deep breath in and out. Great job. Okay, now I want to look at your mouth. And so your lips look moist, not dry or cracking. Can you go ahead and smile for me? Teeth are straight and white, and so that indicates good nutritional status. Can you go ahead and open your mouth for me? Buccal membranes look good. Tongue is pink, no white, so good hydration status. And teeth and gums look great, no bleeding. Go ahead and stick out your tongue and say ah, ah. Okay, tongue comes out midline and uvula rises midline. I'm just going to test your gag reflex. Great job, gag reflex is intact. Now we're going to go ahead and look at your neck and some of the lymph nodes in there. So I just want you to tell me if you have any pain or tenderness when I press down. All right, from what I'm feeling, the lymph nodes are palpable. That's a good thing. I'm just going to check for the carotid pulse one at a time. Okay, now we're going to test your range of motion. Just go ahead and lift your head up and down for me. And side, ear to shoulder, and look side to side for me. Okay, now we're going to test your muscle strength. And so I want you to, I'm going to press your shoulders down, go ahead and shrug for me. Okay, and then use your cheek and press against my hand, and press against my hand. Good job. Now we're going to check out your upper extremities, and so I just want to look at your radial pulse. I'll give it a 2+, equal bilaterally. Let me make sure my video is still working. Perfect. Okay, next we're going to test your muscle strength. So just go ahead and stick out your arms for me and press up with your arms. Press down. Okay, now we're going to look at your hands and do that, and press down, and then press up. Yeah, that was it. Okay, Next, we're going to look at your chest, and I'm going to look at your back first. Your back and then your chest. So, from what I can feel, no lesions or masses. And look, her shoulders, scapulas look even. So what I'm going to do is I'm going to have you take a deep breath in and out. Thoracic cage expands symmetrically bilaterally. And do you have any tenderness when I'm looking here? Okay. And then I am going to palpate the length of your spine. Vertical, straight, there's no scoliosis present. And I'm going to kind of bang on your back pretty hard. I just want you to tell me if you have any tenderness. Okay, next we're going to listen to your breath sounds. If you're comfortable with that, yeah, that'd be great. So every time I move my stethoscope, just take a deep breath in and out for me. All right, your lungs sound clear and symmetric bilaterally, and they expanded symmetrically bilaterally, and there's no adventitious sounds. So that was your posterior and lateral chest sounds. So now we're going to look at your anterior. So go ahead and if you could flip around for me, that'd be great. Just observing respirations. It's not hard for her to breathe, and she's breathing normally, and her chest rises and falls. Her skin is warm to touch. No masses, lumps, any tenderness when I'm touching. Okay. Now I'm going to listen for your breath sounds into your chest. Just go ahead and do the same thing for me. Okay, your breath sounds are clear, symmetric bilaterally. So now we're going to look at your heart. So if you could just flip towards me and go ahead and lean forward, and I'm going to listen to your heart and for any murmurs. Okay, now I'm going to check your apical pulse. Okay, the rate and rhythm feels normal and within normal limits. So now I'm going to just kind of do a motion where I'm using different parts of the heart. Okay. And here for sounds, just to double check that rate and rhythm. All right, the rate and rhythm sound great. I was just listening for that kind of lub-dub of your heart with both sides of my stethoscope, and both sounded great. So now I'm going to have you turn, kind of lean to your left side, and I just want to check that apical pulse again. out one more time with you, lean that way.
Okay.
Okay, everything sounds great, thank you. Next I'm going to look at your abdomen. Are you having any pain or tenderness? Okay, go ahead and lean back for me. I'm going to expose your stomach, is that okay?
Yeah.
Alright, the first thing I'm going to do is auscultate, and the contour of your stomach is flat, and skin looks even, pigmentation, maybe a couple little freckles, warm to touch, but smooth and not dry or anything. You start in the right lower quadrant. And listen for vascular sounds. Okay, no vascular sounds were present, and you were not hypo or hyperactive necessarily in all four quadrants, but I would say it's normal. So now I'm going to just palpate with my hands if there's any enlarged organs, or if you have any pain or tenderness, just let me know. Just going to go lightly at first. Feeling for some different organs. You doing okay?
Mm-hmm.
Okay. I'm going to go a little bit deeper. Great job. Now I'm going to look at your lower extremities.
Okay.
You can go ahead and sit up. If you want to maybe scoot back on the table a little bit.
Oh, yeah.
I'm just going to check my screen again. Okay. Good. No, you're fine. All right. Skin is warm to touch. Some freckles. Hair is symmetrical bilaterally and placed evenly. No varicose veins that I can see. If you had a gown on, I would be able to expose a little bit more of your leg, but that's okay. No edema. I can help you take off your shoes. No edema present around our ankles or feet. Okay, now I'm just going to check for your Sal's-Pettis pulse. All right, I would give it a 2+ for all 4 of those pulses. Next, I want to check your muscle strength. Okay, so go ahead and press against my hands. Great job. And then press towards you. Great job. Those are even. I'm just going to check bilaterally. And if you have any questions for me, any concerns, okay, you look great. Kelsey, we'll see you next year.
Okay, sounds good. Thanks.